Welcome. You know, on most Sunday nights, we talk about the fun and frivolity and the big plays in the world of sports. But tonight, we have a special edition of Sports Rock, and it's probably something you've never seen before on television. Tonight, we're taking you inside the operating room. These are three words that will make even the greatest baseball pitcher shudder. Tommy John surgery. And as devastating as that surgery is, as advanced as that surgery has become, the road back from Tommy John surgery is long, painful, and offers no guarantee that a pitcher will be able to regain his top form. The surgery is named after the former Major League pitcher. Tommy John was solid, if not spectacular, in crafting a 26-year Major League career. In 1974, while pitching for the Dodgers, John snapped the major ligament in his pitching elbow, the ulnar collateral ligament. Legendary sports orthopedic surgeon Dr. Frank Jobe pieced John's elbow back together again, using an arm tendon to replace the broken ligament. More than 150 current or former major leaguers have had Tommy John surgery. The list includes current Cincinnati Reds Arthur Rhodes and Edinson Volquez, and former Red Jose Rio, who's had Tommy John surgery on his right elbow 3 times. But what exactly is Tommy John surgery? How is it done? How long is the recovery time? And if you play sports on any level, how can you avoid having to have it? Tonight on this special edition of Sports Rock, we'll take you inside the operating room as an elbow ripped apart by excessive wear is pieced back together again using Tommy John surgery. But this isn't just any elbow, and it doesn't belong to any professional baseball player. It's an elbow on a 14-year-old boy. His name is Tyler Richards, and a little more than 2 years ago right now, Tyler was pitching for the Hamilton All-Stars in the Little League World Series. In fact, the only game Hamilton won in Williamsport was the game Tyler pitched. He was 12. But now, as a 14-year-old 8th grader, pitching for his amateur team in Hamilton, Tyler has blown out his elbow. He is far too young for this injury, but far too often, doctors are seeing patients Tyler Richards' age.
A 14-year-old boy sitting on my operating room table going to get their ligament looked at and have the same operation the Cincinnati Reds and these other major league players get. That's too young.
Tim Kremchek has been an orthopedic surgeon for a long time, 19 years. Working out of the sprawling complex known as Beacon Sports, Kremchek is also the Reds team doctor. He's also gained fame for his surgeries on players from other ball clubs. Kremchek didn't invent Tommy John surgery, but he's perfected it. He's here today for a final pre-op visit with Tyler.
It's always been kind of sore, and just never told anybody about it because I wanted to pitch, and I don't know, I just got to him, I guess, the last game that I pitched.
But getting Tyler fixed will require major invasive surgery. Coming up, we'll go inside the operating room as Dr. Tim Kremchek pieces Tyler's elbow back together. Later, how you can make sure your son or daughter can avoid what's about to happen to Tyler. It's all on a special edition of Sports Rock, Tommy John surgery, and it continues next. Welcome back to this special edition of Sports Rock. You know, a lot of kids want to grow up and become Major League Baseball players. It's a great way of life. Most Major League players earn in 1 year what a lot of people earn in 10. Maybe in their entire working lives. What kid wouldn't want to emulate a Major League Baseball player? 14-year-old Tyler Richards is living one part of a Major League Baseball player's life today. He is about to have major arm surgery.
Okay, you guys ready?
The former 12-year-old star of the Hamilton Little League team that went all the way to the Little League World Series in 2006.
Hamilton's Tyler Richards would throw perfectly, striking out the side.
Is about to have his elbow reconstructed. Richards is part of a growing and disturbing trend. Teenaged pitchers overworked with poor pitching mechanics that have them in a hospital bed en route to an operating room. In Alabama, noted sports orthopedic surgeon Dr. James Andrews says he's done elbow reconstruction on 224 teenagers just in the last 4 years. Andrews began to study the reasons why. Too many teenage pitchers were throwing too many pitches, most pitching for multiple teams with overlapping schedules. Communication between parents and coaches and between coaches and coaches was limited at best. Mechanics are another mitigating factor. According to a study done by Andrews, it isn't a curveball that puts the most stress on a young elbow. A curveball thrown improperly is much more devastating. Fatigue causes poor mechanics. According to Andrews' study, it's 36 times more likely a pitcher who has pitched past the point of fatigue will wind up on an operating room table. In young Tyler Richards' case, lack of communication has led him to this day at Beacon Sports in Sharonville. Tyler never told his coach or his parents that his arm was hurting.
It's always been kind of sore, and just never told anybody about it because I wanted to pitch, and I don't know, I just got to me, I guess, the last game that I pitched.
Dr. Tim Kremchek will perform Tommy John surgery on Richards. His pre-op speech is the same one he's given to the hundreds of collegiate and major league players he's operated on. This time, he's talking to a 14-year-old.
You ready to go?
Sure.
All right, so just so I'm going to be clear here, what we're going to do is we're going to open it up on the inside. We're going to look at the ligament. We'll explore the ligament, and we'll split the ligament. And then we're going to see if indeed it needs to be fixed, which I think it does by the MRI and all the history. And if it does, we're going to make 2 little incisions here and take the tendon from his forearm, and we're going to transplant it into the inside part of the elbow. Okay? Every case is different, but you have to spend the time to go. Number one, it's very traumatic.
Sure.
You know, the patient is basically missing a year. But you have to make them understand that there's good and there's bad, that we've actually found something that's wrong. We can decrease his pain, allow him to continue the sport that they love to play, but also a pep talk to how important not only the operation is, but then following the instructions afterwards with physical therapy, doing the things we want them to do and not doing the things we don't want them to do, and allowing them to hopefully come back and actually be a better pitcher in this particular case because they've built up the muscles around their body.
The operating room at Beacon Sports is not unlike a performing stage. The patient is the star. There is preparation before the performance. Enter the doctor, the maestro.
And especially when you're doing an operation like this, I need them or I can't do this.
An MRI has revealed the probable tear. Dr. Kremchek's first order of business is to confirm it. He will slice Tyler's elbow open on the inside portion of the arm.
Don't try and do this procedure at home. We are highly trained professionals.
Once under the skin, and before the intricate part of the surgery, the frayed ulnar collateral ligament is inspected.
Actually, this is our first exposure into the inside part of the elbow, and if it is indeed torn, we can reconstruct it.
As he begins to inspect the inside of Tyler's elbow, the ulnar nerve is the first thing that Dr. Kremchek looks at.
And we're going to leave that alone, but that nerve looks fine right there. The next thing we're going to do is split the muscle. Now, this is all the forearm muscles right here that cause tendonitis inside of your elbow when you throw, and you can see how they all go down to the hand.
Kremchek has performed this surgery more than 900 times. A month ago, he performed Tommy John surgery on the ace of the Reds pitching staff, Edinson Volquez. Once inside the muscles around young Tyler's elbow, Kremchek sees a familiar sight.
If you look here, if you look at this ligament is actually, and we are right now onto the ligament on the inside part of the elbow. You take a probe, and you can see from the wear and tear and overthrowing probe